Today we will be doing a neurological assessment, and first I will be asking my patient, can you please tell me your name?
Davidson.
And can you please tell me your date of birth?
August 26, 2007.
And can you please tell me what year we're in?
2022.
And can you tell me what town we are in right now?
Hazlitt, New Jersey.
Okay, and who is the president?
Joe Biden.
My patient is awake, alert, oriented times 4. Next, I will be checking my patient's cranial nerve 1, and I will ask my patient to take off his glasses so I can put the blindfold on. And I will be assessing my patient's sense of smell. Okay. And can you please tell me what this smells like?
Peppermint.
Yes, it is peppermint. My patient's cranial nerve 1 is intact, and I will ask him to remove his blindfold, please. Next, I will be assessing my patient's cranial nerve 2, and I will be assessing visual acuity. Can you please cover one eye, please? And can you please read the lower line?
The lowest.
This one right here.
D, H, J, B, S.
And can you cover your other eye and read this line?
E, P, T, Z, O.
Can you please remove your glasses and read this line right here and cover one eye, please?
T, Z, R, D, O.
And can you please read this other line and covering your other eye, please?
C, R, I, P, I, S.
So my patient's right eye is 20/40 and his left eye is 20/30. Next, I will be assessing my patient's cranial nerve 3, and he will be following the pen light as I move it. Okay, so please follow the pen light. Okay, so we're gonna My patient has smooth movement of his eyes and was able to follow the pen light. Next, I will have him stare straight and I will assess his eye and if there's dilation. So please look straight for me. Can you please? Alright. And there's normal smooth movement of his eyes and his eyes are reactive to light. Next, I will be assessing, I just assessed for accommodation as well, and it constricts, his pupils constrict equally bilaterally on his both eyes. Next, I will be assessing my patient's cranial nerve 5. I will ask him to remove his glasses again, and this will be assessing for sensation of his face and his cheeks and his forehead. So you're going to tell me whatever that I am touching your face with, if it's soft or hard or sharp. Okay.
Soft. Sharp. Hard. Sharp. Soft.
So you can remove your glasses. The blindfold. My patient was able to feel the touches on his forehead, maxillary, and mandibular areas of his face. Next, I will ask him to smile for me, frown, and raise his eyebrows. And as I am assessing that, my patient's facial muscles are symmetrical. Next, I will be assessing my patient's cranial nerve 8, and this is assessing his hearing. And I will be whispering words to you, and you just repeat the sequence of the words or syllables that I said to you. If you could just stand up really quick for me, please. Okay, and sit again, please. And I will remain arm's distance from my patient, and
can you repeat it, please? 4 gave 3.
Okay, and next I will be checking my patient's left side of his hearing.
P73.
My patient's hearing, and here's both whispers in both ears as I whisper to him. Next, I will have my patient say ah, just a minute. He's going to say ah as I check his cranial nerve 9 and also 10, and I will be checking if his gag reflex is intact. Say ah for me, please. Tongue out, all the way out. Say ah. Oh, and his uvula does go up and down, and I will be checking his gag reflex. And his gag reflex is intact. Next, I will be checking my patient's cranial nerve 11, and we will be checking if he has resistance. So I'm going to be holding onto your shoulders, and you're going to try to shrug your shoulders to me. Okay, and he's able to do that with resistance. And I'm going to hold his head, and you're going to turn your head side to side as I'm holding your head. And he's able to turn his head with resistance, and I'm going to have him stick out his tongue for me again. And his tongue is also... Okay, so next we're going to be inspecting my patient's muscles. My patient's muscles are symmetrical bilaterally. There is no redness or deformity or swelling in the joints. I'm going to ask him to move his arm up and down for me. And also this arm. And I'm going to ask you to stretch your legs out for me, up and down. And do it with the left leg. And there is active range of motions without difficulty in all extremity. And I'm going to ask you to turn around for me. There is no spine curvature. Next, I will be checking from resistance. I'm going to have you pull your arms up like this. And I'm going to be pulling on and try to hold on as tight as I pull. There is no, I'm able to pull his arm with resistance. And I'm going to ask you to just push my arm, try to push my arm back towards me. And he's able to do that as well. And I'm gonna also check for resistance on the lower extremities. I'm gonna put my hands in the back of his calf, and what you're gonna do is gonna provide resistance as I try to pull it towards the front, okay? So, and he's able to provide resistance and not able to push it, allow me to push it towards me. And same with the left extremity as well. And I'm gonna have placed my hands on the sole of his feet, and then I'm gonna press downwards, and you're gonna try to pretend that you're hitting the floor like you're pressing on the gas pedal, okay? and there's resistance there as well. There's no palpable tenderness or warmth or joints that are abnormal, and muscle strength is 5 out of 5 against resistance. Next, I will be assessing for my patient's gait and balance. I'm gonna have him step up from the stool and have him walk straight. Okay, just walk like that for me, and then come towards me. And there is no abnormality. His gait is steady and balanced. And next, I'm gonna also have him walk on his tippy toes across as well. And you're gonna walk towards me on your tippy toes. And patient is able to walk on his tippy toes towards me and without any issues. Next, I will have my patient do a pronator drift test, and he's gonna shut his eyes, and you're gonna keep your arms straight, 90 degrees, and keep it straight. And then for 30 seconds, he's gonna try to maintain this position. Can you stand up and do it for me, please?
Keep my eyes closed.
Keep your eyes closed and keep it straight. And for 30 seconds, you're gonna keep that position. All right. Okay. And both arms are maintained equally. All right, and next I will have my patient perform the finger to nose test. Close your eyes again, and you're gonna take both of your fingers and touch your nose with it, one at a time. Okay, and the other one. And there's smooth movement when my patient is touching his fingers with his left and right index, and he's able to return it at his normal position. Next, I will be doing doing a sensory function. Okay, next I will be doing a sensory function test for my patient, and I'm gonna ask you to close your eyes. And as I move your finger up and as I move one of your fingers, let me know if it's going up or down.
Up. Down. Up.
My patient is able to inform me what movement and direction his finger is going to. Next, I will be doing a vibratory test on my patient. And with that, I will also be timing from the time that he feels the vibration to the moment he stops feeling the vibration as well.
Stop.
And my patient felt the vibration for 10 seconds, and there's also expected vibratory sense. Next, I will be doing a cortical test for my patient. You're gonna close your eyes, and I'm gonna place an object in your hand, and you're gonna tell me what does it feel like to you.
Small.
What's the object?
The key.
Okay. And he's able to identify the key in the palm of his hands. Next, I will be doing a graphesthesia on my patient. Again, you will close your eyes, and I'm gonna just draw something on your palm, and you'll tell me what it feels like to you, or what letter or number it you feel like that I'm drawing.
P.
Okay. And then next, I will do a number for you.
15.
Okay. So my patient was also able to identify the trace letter and numbers that I performed on his hands. Next, I will be doing a deep tendon reflex test for my patient. I'm gonna have you extend your arm. Okay. And there is a positive reflex on his biceps. Next, I will do a brachioradialis. There's also a reflex there as well. Next, I will do my patient's triceps. Fold it in like this. There is a positive reflex, and I'm also going to do the extremity as well. And there's also a reflex of his extremity, of his patellar as well. Next, I will be doing a plantar reflex, and you're going to take off your Crocs, please. And you're going to just push this one up. And I'm going to stroke the outer part of his legs. And there is plantar flexion of the toes as well. I'm just gonna go back and do an exteroceptive perception. Again, I'm gonna have him close his eyes. Okay, and you tell me if it's soft or hard, please. Soft or sharp?
Soft. Sharp.
Okay, and I'm also going to do a temperature of his temperature sensation as well. Close your eyes.
Cold.
Okay.
Cold.
And my patient was also able to identify the sensation, temperature sensation of his upper extremity. That was my neurological assessment for today, and I hope you enjoy.